Hi, welcome to the Pursuit of Truth. Last one of the year 2020. A year I doubt anyone's going to forget, or whichever view you take. And I think, and I'm sure I'm going to put this as the title, that is Covid-19 going to be the new 9/11? And I think it is. I think it's going to be something that splits a lot of people with 9/11. You know, there's people who believe the official story, and then there's lots of variants on what happened on that day, alternatives, you know, with planes, no planes, with nuclear weapon grade material, with how could a metal object which is damaged by birds go through a plane, and was the building empty, and all that kind of stuff. The doubt because of some of the things that have been left behind, the passport that came out undamaged, you know, the footage of something underneath the plane as it was flying down, the light that flashes, all those types of things that has changed. You know, a lot of people have seen these videos on YouTube or even on TV discussing what really happened and the impact of that, and the fact that because of that it led to our Prime Minister and the President of the United States lying to the public about weapons of mass destruction, going in and invading Iraq and Afghanistan, and having those wars and getting that oil and that land and that power in the Middle East. And, you know, the fact that there was just a building going down, although obviously if it was 3,000 people that died inside, yeah, that's a lot of people. Now you've got Covid-19, which worldwide has killed over 1 million people. I don't know where they're putting all these bodies. It must be a big job for the hospitals and the undertakers. But yeah, you have the official story, and then you have lots of variants and doubts of it. You know, to do with like the empty hospitals theory, to do with, you know, now the vaccine and all those types of things. So I do think it will be the next 9/11. It's going to be a point where people will split, and it will be an awakening for a lot of people on how things are done. Now, these things may be real. I don't know. Because like I would say, like with the terrorist things, it's easy to make them real and then add extra things to them, then try and fake them. But the thing I want to really talk about in this episode is the AstraZeneca Oxford vaccine, obviously. Now, this one's come out, most of us will probably get this jab. My worry is how they're handling it. And this is the thing that I think is why 9/11 and Covid-19 will be seen as the new 9/11, is because of the way that we've been locked up in our houses, the civil liberties aspect of it, what's really going on, whether this is a way to get people's trust back in vaccines, get people's trust in governments, because those two things have been dwindling over the last 10 years. Since a reawakening, I think, of 9/11 and Flat Earth and things like that, and people seeing Primados and how maybe the media is getting a little bit more attackive of governments and putting them down, whereas in the past they would have been, you know, praising the governments, whereas now there's more investigative journalism around the world showing these things, and maybe we will see in the future things about these vaccines and their efficacy and their safety. But what's worrying me about this a little bit is how they're playing about with it. You know, the fact that they don't want people talking about how good it is, the percentages. You know, because if you've got the Moderna, is it Moderna, the Pfizer drug, and it's 94% or whatever it is, 90% effective, and then you've got this one from Oxford, AstraZeneca, which is only 70%. it does mean something, because the thing I'm thinking of as well is the fact that, is it going to be like a placebo, this vaccine? How do we know that it works? I mean, we've got their word for it, yes. And that's a problem. In the past, we would all accept someone's word for it and would say, yeah, they're telling the truth. They're a scientist, they're a doctor, they don't have any ill intentions, they're not doing it for money. But we know that this is a big money-making scheme. They're making billions out of this. These companies are not doing it for free. They're selling it to governments. And even though this one is made in Oxford, we're not allowed to see some of the transparency, some of the information of how they've got to their figures, because they talk about 70%, 60%, sometimes 94%, and it's to do with the trials. They did. I thought they only did 2 trials, but apparently they did 4 trials, and they've done things differently. And then they've added those figures up to get to this 94%, but they won't say how, and that's worrying. Why won't they say, well, how? It's a lot of gobbledygook and smoke and mirrors that's going on with this, and that makes me more worried. If they were more honest and said, yeah, it's not as good as the Pfizer one, but at least it will, like the normal flu vaccine, it will help some people. But my worry is this, is on the need of taking it. Is if you think yesterday, 50,000 people in the UK got tested for Covid-19, they had it, and 900 people died. So that means, and let's just use those figures as the same day. I mean, the deaths are within 28 days, so it's probably a lot less than that death total. And of course, these 50,000, they may go on to die in the next 28 days. But let's just use these figures as an example. That means 49,000 people got Covid-19 and didn't die. Now, a vast majority of those won't even go into hospital. I don't know what the figure is, but if you think about it, if you've got those people, say you've got 2 identical 50,000s, and that one 50,000 don't give the vaccine, and the other 50,000 you do give the vaccine, whichever one it is, and then the first 50,000, 900 die, 49,000, or let's say like 10,000 go into hospital, but they have complications, maybe a few will die in the future. Let's say 30,000 of them live, and they didn't take the vaccine, and their immune system, their natural vaccine maker, did everything, and they didn't need anything because they survived and had no long-term conditions. But then you've got the other 50% that took the vaccine, and the same result comes, or maybe a few less deaths, because the claim is that it will stop the complicated, the more serious things happening. Now, my problem is how do you know how effective that is? How do we know that it's not just your natural immune system that was doing it all along? This is a money-making scheme. They're putting something into you that does a little bit, but probably for the most of us, we don't really need it because our immune system will do it. But the problem is, because of the people that have died that didn't have health conditions, that may have had underlying health conditions they didn't know about, we don't know. But that kind of scare is that you don't know, do you need it or not? Can you trust your own immune system? Well, you should be able to, because that's what's kept you alive for this whole year, and you haven't caught it. But the problem is you don't know, and that's the fear, and that's where most people will take this vaccine, probably including me, and hopefully it won't do any future harm, because we don't know what the long-term effects may be. But let's say there aren't any. What it may be is just some toxin that's in my body, like the flu jab, that I'm probably not going to catch the thing anyway, or even if I do, my immune system will be the one actually fighting it, and this will just be aiding it maybe, or maybe it won't even need it because I'm young and healthy. And that's the problem, isn't it? And that's where they get away with making billions out of this, by scaring us through the media, by telling us how great it is. But yeah, I'm going to play these things from Sky News. It worried me, just to back up what I was saying, the fact that they don't want to share figures of how they got, because I know what it is. They've cooked the books. The drug is probably 60% effective, but by doing other trials, by giving 2 doses, maybe doing other things, they've got a better figure, or maybe they've had the selection of people that they tested another trial on, maybe they were all very healthy people, and their immune system did all the work, and maybe the first trial they had a more fairer mix of older people who it didn't work so well on. There's lots of ways you can cook the books, and that's the problem with this. That's the problem with how can we trust these pharmaceutical companies, especially when you think of Primados and lots of other things, and governments who will, lie to us about weapons of mass destruction and go kill billions of people, millions of people, thousands of people, whatever it is. The problem is like I always say, that the crux of this is that humans can lie, and humans like power, and humans like money. And until we get rid of those things, we will be a high percentage of people that will find it difficult to trust. And yeah, we may go along with it because we've been bred like sheep through school, through the system that we live in. But there will come a time where that will change. But the thing is, like, this may be a real thing. I'm sure it is. But the problem is, because of the way the prime ministers of the governments lie, and they sugarcoat things because they can't say bad things, it makes people doubt that, oh, wait a minute, are they telling the truth or not? If they just told the whole truth rather than trying to spin it and cover it and make it look like they're the best in the world and there's no fuck-ups and all that kind of stuff. Anyway, let me play you these things so you can make your own mind up. Well, now that I've coloured it.
You have a 70% effectiveness rate. Now, the Oxford vaccine can be stored at between 2 to 8 degrees Celsius, as well as needing protection from light. Crucially, this is the temperature of a normal fridge. The new vaccine will also be much cheaper than the others, expected to be less than £3 per dose. And the government has reserved 100 million doses of the Oxford vaccine, with the first batch released overnight. Our science correspondent Thomas Moore joins us now from the newsroom. Huge news this today, Thomas. Not one, but 2 vaccines available.
Yes, that's very significant. This is a vaccine which is available in a huge quantity, enough for the adult population of the UK, but even more significantly, it can be stored and delivered at fridge temperature. It is a vaccine very much like the flu vaccine, something that GPs and practice nurses will be used to, that they can take out to care homes and give to those who need it most. But there are still big questions over this vaccine and the dose strategy that they are recommending. They have looked at the evidence and they have decided that when they look at the raw data, a subgroup of patients who did have this second dose up to 12 weeks after the first, that interestingly the protection levels increased perhaps even higher than that had been expected, and that is an unusual finding, but they're not giving us the evidence to back that up. The transparency is not there. They are saying that for reasons of commercial confidentiality, they're not sure how much they can release. They say they will release some information in the coming days, but exactly what that will be, we don't know. And when the head of the JCVI was talking about how they found this protection level, he talked about the difficulty in looking at the different trials that AstraZeneca, the manufacturers, have been doing.
The AstraZeneca trials are not too easy to tease out, because there are actually 4 different trials held in different settings, as you know, with different dose schedules. They suggest an efficacy after the first dose, 21 days after, and up to the time of the second dose of about 70%. And that's based on a subset of patients. So one can't directly compare that with the other efficacy data that's published in the Lancet paper.
But look, any vaccine is better than no vaccine, so bear in mind that the flu vaccine can sometimes offer protection of 40% or even lower. So this isn't a bad vaccine. The problem is that people are being asked to have it on a social good, that if lots of people have it, the benefits to society are high, particularly when you have a surging virus as we do at the moment. But the individual protection from just having 1 dose rather than 2, as was tested in the trials, particularly with the Pfizer vaccine, well, that can be lower. So you're asking people to give up that individual protection for the wider social benefit, and that will be a hard message to sell.
Okay, Thomas, for now, thank you very much. Well,
yeah, you see, see there they're saying 70% at best after the 2 injections, and you'll hear Professor Van Tam later sort of tell the media, "Oh, don't try and pit it against the Pfizer one," because the thing is, this is Oxford one. I assume it's got a big link to the UK. This is probably the one that's going to go around the world. This is probably going to make the UK, Oxford, and AstraZeneca a lot of money because it's easier to transport than the Pfizer one, and they have a lot more doses of it. The problem is, and especially with these other variants of COVID-19, which is nothing new because WHO talked about it a few months ago, but they made a big hoo-ha out of the UK variant and the South African variant. And the problem is all these extra ones, which were always, the variants are always around. That's what coronaviruses do. They mutate and they change. That's why we get colds all the time. But the thing is, because they've got that, any person, and I don't know whether they're ever going to report this because they'll be worried about the fear that it will do, that if someone has, like now the second person has had the Pfizer second jab, after 21 days they're immune, as it were, immune, good word, immune system, after they are immune, and if they were to catch COVID, well, they say that you can still catch it, but it won't give you the harmful effects, and they're not sure about the transmissible thing. So that seems a bit weird to me, that you can still catch it, but maybe it won't do it as bad to you. So, but they're not sure about that apparently. But the thing is, the main thing is that will they publish if anyone has both doses and then dies of COVID-19? Or will they put it down to, oh, they had a lung condition, or they had a heart attack, or they had pneumonia? You know, will they tell the truth if there are people who die of it? Because as it's only 94%, that's how you can get away with it. That's how you could get away with giving this thing that's not really doing very much. Now, most people didn't know about the flu jab only being 40 less effective. Imagine every year how much money these pharmaceutical companies make out of giving millions, billions maybe, I don't know how many people take the flu jab around the world. It's less than 40% effective. And the fact is, you probably wouldn't catch those strains unless you're in certain parts of the world where they come, if you look up which strains the vaccine has, the flu jab has in it. So the problem is, they can make this thing, it may be like a little bit effective, and because you've got the new variants, because you don't have a 100% success rate, then anyone that does die of it, they'll just say, well, that's because they had more health conditions, or they were too old, or they didn't have the drug in them long enough, or they were the ones that it wasn't, you know, that shows that it's not 100% effective, or they got the new variant. So there's a lot of wiggle room for these pharmaceutical companies and the governments to sort of say, yeah, this is great, take it, it's working, but really, is it? Is this going to be like, what I mean is, if the figures that we've got now is that 70,000 people have died in the UK, is it 1 million in the United States? They could have all taken this vaccine at the very beginning in March, and the numbers would have been exactly the same, or maybe a little bit less, but not much. That's the worry, isn't it? How do we trust, especially when they want to hide information, because they want to make money out of this, don't they? And that's the problem. If you took the money out of this, and the competition, and different countries and different companies all working against each other because they want to sell it, they want to make the money, then we could all have the best vaccine drug, and we could all have one that we could trust work. They'd all be working together. Maybe they would have got 100%, rather than now some of us having 60, 70%, some of us having 94%. What logic does that make? How stupid. People in the past are going to look back at us and see how stupid humans were, working against each other, when we're all one. Anyway, there's a bit more now.
The Prime Minister to make a press conference appearance at 5 o'clock, but here he is, probably answering questions on all of them. I suspect the thing that he'll want to talk about the most, as you say, was the news this morning that the MHRA, the regulator, has approved the. Let me just shut them up. Has approved the Oxford vaccine, AstraZeneca, for use. Now, I suspect the questions about that will be partly about the speed of the rollout. Matt Hancock this morning talking about 530,000 doses available for rollout from Monday. Now, there is some aspiration in government to get maybe as many as 2 million a week being rolled out in order to try and start inoculating large parts of the population. How will he manage to do that? But also, I think the government will be very, very keen to try and reassure people about the efficacy, the success rate, as it were, of the vaccine. The AstraZeneca, the Oxford vaccine, its success rate apparently is 70.4% compared with 95% efficacy of a shot from the Pfizer-BioNTech, the other vaccine approved for use in the UK. Now, the point about that the regulators will say is both are approved and they're pretty much interchangeable as far as the British medical regulators are concerned. So take one, take the other. When you turn up for your vaccine shot, you won't get a choice, and both are effective, they will say, in an attempt to reassure people. So I think those are some of the messages on the vaccine. But the problem that the Prime Minister faces, the challenge, is just the absolutely incredible soaring once again of the coronavirus rates, with hospitalisations higher than they were even at the peak of the first wave of coronavirus. You've got this extraordinary figure, publicly available figure on the government website, that over the last 2 weeks, case rates have doubled. You mentioned today's figures. 50,023 new COVID cases recorded in the last 24 hours, 981 further deaths, with pictures in the newspapers of ambulances queuing outside hospitals. Now, the government is taking measures, an additional 20 million people in the newish Tier 4 level of restrictions that sees all non-essential retail shut. That will be a heavy blow. Perhaps the Prime Minister will be asked when people can expect eventually, because of the vaccine, to see some of those tiering restrictions lifted, if there is much hope over the horizon. I suspect Boris Johnson, who talked earlier today about always trying to get people through by being on the optimistic side of a lot of the arguments, tries to paint a better future. But the bottom line is that that extraordinary growth, it doesn't even yet really take into account household mixing over Christmas, where it was permitted. And of course, large parts of the south and east of England, it wasn't allowed because of the new variant of coronavirus and the fact that case rates soared dramatically through that period. But you've now got the Midlands, parts of the northeast and northwest, and parts of the southwest also among the areas that have been put into that Tier 4 level of coronavirus restriction, and that will be very painful. But another breaking news story, as it were, on top of all of that, is part of the government's response to all of that has been effectively to push back by a week their plans to reopen secondary schools. And that slightly bemusing announcement that John Craig was referring to, which is that some primary schools in some Tier 4 areas won't be reopening next week, but we know not which ones they are, because the Secretary of State was unable to have a list to hand when he stood up and addressed the Commons, and promised that it would be up on the gov.uk website, and it has not appeared. So there are parents all around the country, millions of parents all around the country, waiting to find out whether their kid will be back at school on Monday, waiting for a link on a website that hasn't yet appeared. So perhaps the Prime Minister will be able to give some certainty around that. But I suspect he will really want to try and focus on the good news of the vaccine, coupled with the need in the meantime, while the vaccine starts to be rolled out, with the need for everybody to try and obey the rules at the moment, even if they are as tough as they are in Tier 4 areas. There is now nowhere in Tier 2, the second lowest, and just the Isle of Scilly in Tier 1. So almost the entire country unable to enjoy hospitality and go to pubs, and almost everywhere now, large parts of the country now, living with non-essential shops open. So that, I suspect, is going to be the new normal for many, many people across the country for weeks and weeks to come. Overlaid with that, of course, is the uncertainty
as well as the political victory of the Prime Minister today of what the new relationship with the European Union looks like. Of course, it was...
Thanks very, very much, Steve. And I'm sure everybody will echo what you've just said about our wonderful NHS care workers, everybody keeping people safe this winter. Let's go to questions from the public and sorry, yes, of course, JBT. Would you say something about the vaccine? Thank you.
Yes. So it's not all bad news from my corner of the room. It's actually also a very good news day with the authorisation of the Oxford AstraZeneca vaccine. And I want to really thank the scientists who've worked night and day for the last year getting this vaccine together, and also thank the doctors and nurses of the National Institute for Health Research, the NIHR, without whom this whole trials programme could not have come together in the way it has. So, you know, we have MHRA conditions for the new vaccine, authorised, very standard conditions, quite what you'd expect for any new vaccine. The JCVI has made an announcement that the vaccine should be pressed into service immediately alongside the Pfizer vaccine. The JCVI's view is that these are two good vaccines with no major distinctions between them. Now, I want to caution everybody, particularly the media, about over-forensic examination of percentage vaccine effectiveness. It's really important to remember that the definition of illness in the Pfizer and the AstraZeneca programs were different, so they were slightly different endpoints, so you can't really compare them. But what really matters to us is not an endpoint that measures illness, but how these vaccines are going to impact on severe disease, on hospitalisations, and on deaths. And I'm confident, and I think the JCVI are also very confident, that both of these vaccines will do that. There is already some preliminary data from the AstraZeneca programme. There have been just 2 hospitalisations in the whole of the clinical trials programme in patients who received the vaccine. One hospitalisation occurred 2 days after the vaccine was given, so you can easily work out that the infection occurred before the vaccine was actually administered. And the second one occurred 10 days after the vaccine was given. And again, 10 days is not long enough for a vaccine to work. Optimistically, you'd say 7 to 10 days you might get some effect, but far more typically, it's 14 to 21 days where the effect of a vaccine is going to kick in. So they weren't really vaccine-preventable hospitalisations, and this is very, very encouraging, albeit preliminary data. The other really big thing that JCVI has changed for us in the last 24 hours is this very clear advice to prioritise the first dose to as many people as possible. This makes enormous sense to me as somebody who's public health trained, and I'll try and explain why. Firstly, the JCVI are very confident that there are high levels of protection from both vaccines after the first dose. Secondly, the MHRA has given the operational flexibility around the interval between the doses, so that operationally there is room for manoeuvre now. The second dose of both vaccines is integral. It remains important for longer-term protection, but the priority is the first dose. And so what does that mean in terms of, how's this strategy been put together? I want to try and help people understand that. And basically, you take what you've got, you work out what you're going to get, you look at the epidemiological situation in front of you, and then the scientists and the modellers from the JCVI put all that together and they say, how do we get the maximum benefit for the most people in the shortest possible time? And that's the approach they've chosen, and this has been strongly endorsed by all 4 chief medical officers of the United Kingdom. Thank you, Prime Minister.
Thanks very much, JBT. Let's go to questions from the public and.
So yeah, there he's cautioning people not to look at the figures because they're different endpoints or different definitions of illness. It'd be interesting to know what their different definitions of illness were. I mean, that may show more light on how effective these things were. Maybe one of them was they made the definition of illness as long as it didn't get a person into hospital was a definition of illness, and the other one was that they didn't die of it. Well, that would make a big difference, because then you know the one that you really want is the one who didn't die of it. I don't know. And you see, this is how, because the thing is we don't have all the access to this information, and a lot of this maybe we wouldn't be able to understand if it was put out, because it's in gobbledygook and it's in information that we don't understand. But it would make it good if they published some of these things. So these are the things, you see, if you didn't say this thing, we wouldn't know that there were a different definition of illness, because we'd all expect them to be working for the same definition of illness as it's someone who we want to stop people from catching this thing in the first place, or we want to catch, well, there's maybe the difference is maybe one of them is so you don't catch it, and one of them is that you don't die of it. But you see how it doesn't matter, you can take this jab and you can die of it. 10 days, it used to be 8 days, wasn't it? That you would, between 2 to 8 days, you would get the symptoms. Now, someone had it for 10 days, they had the vaccine, the first one, and they still went to hospital. So there's always, you can always, and the thing is, these numbers, if you look at it, the actual numbers of people catching this, numbers of death are very small. It's a lot of people dying of it, but percentage-wise of the UK, when you've got 60 million people, and how many is it, 70,000 people have died, what is that in percentages? And 70 million people, how many people have caught it now? 500,000? What is that in percentages? So if people take this vaccine and it doesn't work for them, because maybe it's not really doing very much, those people will be very small amounts anyway, percentage-wise, and then they can just say, well, that it's still working, but that's because it was not 100%. And how can it be 100%? We're not gods. But if they all work together, and they took out my money, assuming this is a real thing, or as bad as it really is, I should say, if they all worked together and they didn't have money, what could we achieve? This is another problem with the system that we live in, that because of the way the system is, it makes us work against each other, it makes us compete, and it makes people produce lower quality things, but then try and oversell them to be in the running, to get that money. Which of course, if we didn't have that money in competition, we wouldn't think like that, because we're thinking, we're all working together, I don't know, I'm wasting my breath, aren't I? We all know this, and we all accept it. Take care, Daisy. God bless and peace.